All right, so chapter 12 is going to be talking about shock, and hands down, this is one of the most important things that we are going to talk about in the class, not only because of how important it physically is to the patient, but also this is one of those topics that is very heavy on the state exam. So I want to make sure that you guys have all of the resources that you need, and it's something that we will be testing on quite heavily and also discussing quite heavily as we move forward. So just make sure you see some other assignments that are related to this, that you have a really thorough understanding of what shock is and all of the different types. So we're looking at shock, and the other term for that is hypoperfusion. And so this describes a state of collapse and failure of the cardiovascular system. Now, when this first happens, the body is going to attempt to maintain homeostasis. So it's going to do everything it can to try to compensate and keep everything the same. And we'll talk about the ways that it does that. But the very first thing it does is increase the heart rate, and it's going to increase the respiratory rate. And it's going to try to keep everything the same for as long as it can before we actually start to see some negative effects happening within the body. Now, we'll look at the different causes of shock, but they could be medical or traumatic in nature. So we want to keep that in mind as well. Some types of shock have a quick fix and an easy treatment. Some do not. Some are a little bit more extensive. So we'll take a look at those different types as we move forward. Looking at some pathophysiology, adequate perfusion is required to provide cells with oxygen and nutrients and remove waste products. So that means that as we're going to talk about what the perfusion triangle is and how that works, you've got to also have an adequate amount of oxygen and nutrients and the ability to remove waste products for perfusion to be functioning the way that it should. So it's not just about the blood flow. We've got to have good stuff in that blood as well to be able to sustain life. So any compromise here in the areas that we're going to talk about can lead to cellular injury or death. And kind of what happens in the breakdown of that is you'll start to have individual cell death. If enough of those individual cells die, you'll start to have larger pieces of tissue, so tissue death. If a large enough piece of the tissue dies, then that would lead to organ death. That could lead to organ system death if you have multiple organs in one system, and then ultimately that could lead to death of the organism. In cases of poor perfusion or shock, transportation of carbon dioxide out of tissues is impaired, so you're beginning to build up waste products, which in itself is very dangerous, as we're going to take a look at what that can lead to. So shock refers to the state of collapse and the failure of the cardiovascular system that leads to inadequate circulation, like we said, and it can be life-threatening, and it does require immediate recognition and rapid transport. So we need to be treating for this early. If there is any reason for us to suspect that the patient could be or could have the potential to go into shock, then we want to go ahead and start treating for that aggressively early on. We don't want to wait until we see those signs of decompensated shock, which we're going to discuss. It's often too late if we begin our treatment by that point. We want to start it as quickly as we can. So the cardiovascular system, it consists of three parts, and that's the pump, which is the heart, your set of pipes or your container, which are your blood vessels and arteries, and then the contents, which is blood or fluid. And so this is essentially what the perfusion triangle is. And when we look at this in a breakdown in just a second, you're going to see that any issue with any part of this can lead to shock. So like I said, those three things are considered to be the perfusion triangle, and they've all got to be working properly together for things to be going the way that they should. So you've got to have a good, strong pump. You've got to have a good container that can hold your fluid, and you've got to have enough fluid to fill that tank. And so then on top of that, we've also got to have enough oxygen, enough nutrients, and the ability to remove the waste products. So all of those things really work together. So just taking a look over here at the example in the perfusion triangle that it gives you. So if you were to have failure of the heart or the pump function, so damage to the heart by disease or injury decreases the ability of the heart to properly function as a pump. Therefore, it cannot move enough blood through the body to support perfusion. So basically what's happening here is something's wrong with the heart, and that could be from a variety of things. It could be cardiogenic shock, which we're going to look at, where the heart is actually weak and sick due to damage. It could be some type of obstructive shock, which has literally impaired the heart's ability to pump. Looking down at the blood or content function, so if there's enough blood or plasma loss, the volume of fluid in the container is not enough to support the perfusion needs of the body. And that's pretty self-explanatory. This is going to come from a blood or fluid loss. Now, with the container function or the blood vessels, that's where things start to get a little bit more tricky. If all of the blood vessels dilate rapidly, the normal amount of blood volume is not enough to fill the system and provide adequate perfusion to the body. So taking a look at this here, if we have a normal size tank, all right, we'll just use tank for an example, and it's full. We've got enough blood to fill it up. There's good pressure in there. Everything's going great. But now suddenly, without warning, we double the size of the tank. We don't have enough fluid to fill that tank. The pressure is down. And that's really what's happening in all of these distributive types of shock that we're going to look at is we've doubled the size of the tank where the blood vessels dilate all at one time. And so we'll look at some examples of what can cause that and different types of shock that can cause that in just a few minutes. But I want you to have a good understanding of these three things that can affect perfusion. So again, like we said, perfusion does require more than just the cardiovascular system. You've got to have good, adequate oxygen exchange in the lungs, good, adequate nutrients as far as glucose especially, and adequate waste removal primarily through the lungs, but we can also get rid of waste products through the kidneys and through fecal matter as well. But the big one is going to be through the lungs when we exhale. Now, like we said, looking at those causes of shock is going back to that perfusion triangle. So it's usually going to come from one of these three things: pump failure, poor vessel function, or low fluid volume. And so some of these examples, and these are not all of them, we're going to look at a few more as we progress forward, but a few examples of each one of these. So pump failure, so something like a heart attack or trauma to the heart, that's physically blocking its ability to pump or function the way that it should. Low fluid volume, like trauma to the vessels or tissues, or fluid loss from the GI tract, like with vomiting and diarrhea. Those things, all a fluid loss that can affect the ability to fill that tank. And then the last thing here is poor vessel function. So again, a lot of things that can cause this: infection, drug overdose, spinal cord injury, anaphylaxis, are just a few examples. And essentially what happens here is we have that rapid, widespread vasodilation, and we've doubled the size of our tank, and now we don't have enough resources to fill it. So again, just a few examples of those, and we're going to break these down and look at each one a little bit more closely. So related to pump failure, you usually have cardiogenic shock and obstructive shock. Now, cardiogenic shock is a beast all on its own, and usually cardiogenic shock is related in the days after damage has occurred to the heart. So if you have an actual heart attack or a myocardial infarction, the damage to the heart is what causes blood and fluid to begin backing up in the lungs and in the rest of the body, ultimately leading to that cardiogenic shock. Now, with the obstructive shock, you've got several examples here, and these are some of the most common. And the best way to think about obstructive shock is literally something is obstructing or preventing the heart from being able to pump or function the way that it should. So tension pneumothorax, where we've got air building up, is compressing one lung, collapsing it, and it begins to push over onto the other lung and onto the heart. All right, once we start to compress that, if that pressure is not relieved, then yes, it can affect the heart's ability to pump. And then we have the pulmonary embolism, which is a large blood clot inside of the lungs. And so again, all of these things can obstruct the heart's ability to work. So those types of shock, cardiogenic and obstructive, are most related to pump failure. Now looking at low fluid volume, I'll skip down to the bottom. We have two types of shock that fall under hypovolemic, and that's hemorrhagic and non-hemorrhagic. And so just like its prefix would lead you to believe, hemorrhagic is related to blood loss and non-hemorrhagic is related to fluid that is not blood loss. So like we said, with the nausea, vomiting, and diarrhea is going to be the most common. We can also lose fluid through burns. So that's another example there, but those are hypovolemic types of shock. Now with the poor vessel function, which is making up the largest list here, we call those distributive shocks. And so distributive shock houses septic shock, which is related to infection, neurogenic shock, which is related to spinal cord injury, anaphylactic shock, which is related to our life-threatening allergic reaction, and then psychogenic shock, which is the only one on this list that is temporary and can correct itself. All right. And so we'll get a little bit more in depth with that as we go through the list of treatments and things like that. But these are the different types of shock. So you want to know not only what category they are, but also what are the different types that fall under that category. All right. So just make sure you have a good understanding of these types and how they break down and what it is that they are affecting. And I'll catch you guys in the next portion of the video.